Public health experts in the UK have spoken out against a new book that claims many of us should be eating more salt, not less, claiming the advice could endanger people's health. New York scientist James DiNicolantonio says in his book The Salt Fix that the World Health Organization and the US and UK advisory bodies on diet have got it wrong with their advice to cut down on salt. Salt is necessary and good for us, he says. Eating more salt will reduce the amount of sugar in our diet and help us lose weight, he says. Indeed, low-salt diets may be causing brittle bones and memory loss, and more salt could fix diabetes, he claims. Research criticizing 1980s fat guidelines misguided, say scientists. Read more. Instead of ignoring your salt cravings, you should give in to them. They are guiding you to better health, he argues in his book, which has won attention for his ideas in the UK media. Most of us don't need to eat low-salt diets. In fact, for most of us, more salt would be better for our health rather than less. Meanwhile, the white crystal we've demonized all these years has been taking the fall for another, one so sweet that we refused to believe it wasn't benign. A white crystal that, consumed in excess, can lead to high blood pressure, cardiovascular disease, and chronic kidney disease, not salt but sugar. But Public Health England PHE, speaking out as promotion of DiNicolantonio's book gathered pace in the UK, said his advice was not only wrong but dangerous. Professor Louis Levy, head of nutrition science at PHE, said, "Diet is now the leading cause of ill health. By advocating a high-salt diet, this book is putting the health of many at risk, and it undermines internationally recognized evidence that shows a diet high in salt is linked to high blood pressure, a known risk for heart disease. Our work with the food industry to cut the salt in food has already seen consumption in the UK reduced by 11% and is seen as the model to aspire to globally." The row follows other diet controversies, such as the renewed debate over saturated fat and cholesterol.